So we're going to talk a little bit about photodynamic therapy, or PDT, today. And we have one of our lovely volunteers, Nancy, who's here to simulate a little bit about what happens. It's a treatment that's great for sun damage and for precancerous skin changes. We usually would treat a head and neck area on a patient. And what's involved, and we'll walk you through real briefly, is basically we would cleanse the patient's skin with a little bit of alcohol. So we're just going to take all the natural oils off the top of Nancy's skin. And then we're going to apply a sensitizing solution. So what this does is basically get absorbed by the sun-damaged cells. And what happens is then that medicine is activated in those cells, and we let it incubate for a period of about 30 minutes on up to a few hours, just depending on the area that we're treating. At the end of that time, then we would go ahead and get this lamp and light treatment, and we would bring this over, position this right in front of Nancy, and get it just a little closer in front of her face. And there's going to be a blue light that is emitted. She would sit there in front of the light treatment for approximately 15 minutes. There's going to be a little bit of burning and stinging that will tend to maximize in the first 5 minutes or so, and it gradually gets better with time. At the end of the treatment, we get her out of the light box. She's going to have her skin cleansed and removed of all of the solution, a sunscreen applied, and probably the hardest part that follows is she's still going to be sun sensitive for about the next 48 hours. So she's going to need to really be faithful about avoiding sun exposure. Over the next week, she's going to have some light exfoliation and a removal and improvement in her skin tone and texture, and all those precancerous areas should be improved.